Hello, everyone, and welcome to the Happiness Journey with Dr. Dan podcast, where every journey is worth living. My name is Dr. Dan, and I'm your host for today's episode. I'm a bilingual cognitive behavior psychotherapist specializing in anger management issues, both court-appointed and private, marriage counseling using the EFT method, dissociative disorders, narcissistic personality disorders, depression, anxiety, dream analysis, and also provide life, business, and retirement coaching support. I provide individual one-on-one session in English or in French, and also do group settings. If you need any assistance, reach out to DMB Therapy and Coaching Services at 301-325-1550, and our website can be found at lifecoachddanamzallag.com. Today, I'm very excited to have for our 9th episode of Season 9, a very special guest in internal medicine, Dr. Rob Barkett. And just like every of my past episode, I will leave it up to the guests to properly introduce themselves, as no one can do a better job. Rob, the floor is yours.
Well, glad to be on your show, Dr. Dan. I really appreciate it. I am an internal medicine physician in Mansfield, Ohio. I've been practicing for 30 years after getting my medical degree from Thomas Jefferson in Philadelphia and my residency at Riverside Methodist in Columbus, Ohio. And I've seen all the challenges and changes over medicine in the past 30 years, and they are not all good. I wanted to write a book, which I have, called Simple Medicine, No More Google Searches, which is the first book ever written for the patient. It is written in very simple English, or what we call layman's terms. It is a quick read. Everything is concise and to the point, and it's dealing with the most common problems and medical complaints every individual have during their lifetime. And they can go to that particular problem, such as diabetes or hypertension, chest pain, back pain, and find out truly what are the most common problems. And so they don't have to do any Google searches where they feel like they're going to die in 3 days and they're ready to jump off the cliff. They can just go to a simple chapter. It's written in Cliff Note version, and I'm hoping to ease their mind. But most importantly, I want to give them knowledge, because the more invested patients are in their medical care, it's been proven the benefits and outcomes are much improved for them.
Beautiful. Well, Doc, it is an honor to have you on our podcast, and I'm sure that a lot of listeners today will definitely take advantage of all your extensive knowledge in that field. So let's get started. As you know, before we started this podcast, we talked about one very special or specific motto that says, "Health is wealth." Okay, so
Yeah.
You could be the richest man in the world. You could pay for the best treatment, whatever it is. But if you are sick and in bed, no money can really make you healthy, So how would you guide your patients, doctor, when it comes to how to take better care of themselves? Obviously, they all depend on medication that is being prescribed by their doctors to be able to either treat diabetes, treat high blood pressure, heart murmur, whatever it is. So how do you go with it or about it?
Well, I'm still an old-fashioned doctor, and I still think you have to do it yourself. I think people have been a little bit more reliant on medications. Doctors seem to push pills all the time. We call that polypharmacy, meaning too many medications. And you have to go back and do it yourself. You have to follow a proper diet. You can't be going out to eat every night. You have to watch portion control and really decrease your carbohydrates of the potatoes, pastas, breads. I call them the 4 Ps: P, potato; pasta; P, Panera bread; and P, pastries. I don't like people eating after 7 o'clock at night, and I highly recommend 3 hours of exercise, whatever you like to do, every week.
Beautiful. Now, there's a big, not rant, but intermittent fasting has been taking a tremendous amount of popularity in the past few years. Now, do you, as a doctor or physician, do you encourage intermittent fasting for the majority of people to be able to kind of stabilize their glucose level in their body, not to be able to be insulin dependent, and to be able to kind of readjust their system to be able to know when is the key or the best time to eat and when you should stop eating, how you should hydrate, etc.?
I wouldn't say majority, but I really feel that is beneficial. The way I usually handle with most of my patients, I give them options. And I want them to go on the most appropriate diet for them because they have to want to follow it and be sustainable.
Mhm.
There's all these fad diets, and yes, they go on this and they lose 20 pounds, in 2 months. Then you see them in 4 months and they've gained, it all back.
Yes.
So I want people to do and research what they feel is best for them because most of these diets and recommendations will be successful if they can continue and sustain it.
Okay, so when you mentioned just earlier, doctor, about low carbohydrate diet, so we're talking about Atkins, we're talking about keto, and so on and so forth. So again, it's all about sustainability. People just kind of like are jumping into something. They're not well informed. They do not know how their body will react to that new diet, and when they do not see the immediate results, they give up. So do you think this is long term that they will see results, or will they see the most weight loss in the beginning, but after that it will plateau?
I've seen it both ways where they get really frustrated and they've done it for 2 months and they're just not seeing any results. And then poof, that third month, if they stick with it, all of a sudden 10, 12 pounds goes off. I've also, like you said, see where it works right away and then it plateaus. And then it may be a time, just like for physical fitness, cross training, you may want to mix and match some of these diet plans and nutritional plans.
Okay, and when it comes to the exercise routine, you said 3 hours a week. So we're talking about like close to 45 minutes a day, approximately, like in a 5 or 6 day. So do you encourage more cardiovascular training versus resistance, or where do you see the best result? Because again, when people are going in a diet, do they have to focus primarily on the scale, or how do their clothes fit? Because a lot of people don't know the difference.
Right. I recommend usually about 65 to 75% aerobic training and about 25 to 30% of resistance and weightlifting. And as we know, it's, when you start working out and turning that fat into muscle, sometimes you're not going to see the scale of the weight loss, but, your belt waistline may go from a 36 to a 34 or a dress size from 12 down to 10 or 8. And I think people should just stick with, and the exercise they should do. I don't care what they do, if they want to do it 10 minutes twice a day, an hour, 3 times a week. But if they get that 3 hours in, that's what is recommended. And they will see results. They'll feel better. They'll get the endorphin rush. They'll lose their double chin. They'll lose that belly, and their face will thin out, and they can honestly see it. And people are a lot of times very complimentary and love that look.
Oh, I agree with that. So do you think that the new, not those fat diet, but this new way of living when it comes to eating properly and exercising and all that, can it cure most of the ailments that people depend too much on medication on?
Well, I don't want to push this too much because I would lose 3/4 of my business if they would work the hard way.
Okay.
I mean, I think it would not need diabetic medication. You would not need your high blood pressure medication. It's unbelievable, but especially abdominal obesity is as carcinogenic as tobacco. So you would see much less cancers. You would not run into hip and knee replacements from osteoarthritis down the road. And if you can maintain an ideal body weight, your health would be much improved and you would most likely require very few medications. But there's always genetics. But for the
Yes.
most part, I think we could eliminate 80% or more of our medications.
Beautiful. So do doctors really, again, focus primarily on the body mass index to determine if someone is obese or not? Or is it now because there's so many other factors involved? Or if someone is a professional bodybuilder, their BMI may be 34, 36, even 40, but then because their weight versus their height, they weigh more because they're more muscular. So is it really still a good indicator to determine if someone is obese or not?
That's a great point. And, you can look at that BMI all day long and say there's no way in the world this person, can be in the best shape of their life and, still be considered obese. And so you're like, I honestly look at it only when people want to lose weight and they would like some weight loss medications. And then we're obligated, no matter what their stature is, to look at the BMI. And if it's over 31, they can use the medicine, or 27, above 27 with comorbidities like diabetes or high blood pressure. But when people ask me what their ideal weight is, I will look at their height, weight, their BMI, and then look at their bone structure. And, a lot of times it may be 30 pounds heavier than, what that BMI is. So I don't place much in the BMI.
Okay, I see. So if we go back to helping your patient or helping any patient to be able to kind of like take control of their own health, okay? We see a lot of people they don't know where to start. They go, as you mentioned, they go on Google, they start searching, how can I lose weight? How can I eat better? How can I do this? But again, if they do not have that discipline, isn't it better to be able to train their discipline first before they could start training their body? Because it's all in the mind first before the physical body follows. So isn't that like more of like, if you see someone that is overweight, said, you know what, maybe therapy and relationship with food may be a better option for you now. And once you get that resolved, then we can go and discuss about what are the next option for you to be able to start losing the weight that you need.
Yeah, I that in the ideal world, that is exactly what should be done. And before in medicine, we would consult a nutritionist,
Mhm.
and insurances would pay for it. And most likely that's when they have diabetes or high blood pressure, morbid obesity. But in today's age, we don't have that, and insurances aren't covering that, which is just awful, because that is the first, second, and third treatment for most of our diseases. Is mental, is again becoming more aware of the condition, the education of it, and like you said, the discipline. And that's what it takes. It just takes discipline.
And many people do not have that because are they not so eager to be able to get healthier, or do they still depend on those chemical medications that are being prescribed to be able to find like that magic pill, as many always like the fountain of youth, or if I take this medication Lipitor for cholesterol. So then again, you said sometimes it can be genetic, because you could eat broccoli all day long, but your cholesterol level can be at 300. So
Correct.
again, how can you work around that? Because sometimes genetics, no matter what you do, doctor, it will not solve the problem.
Yeah, in that situation, and I deal with that daily, uh, and people will become frustrated, but then you just have to say, well, you got to thank your grandparents or your parents for that, and we do have to go with medication.
Okay.
And they those seem to be a little bit more rare these days. People love the comfort of food. It's look at all the restaurants we have, and all the bakeries and sweets and special coffees, and it's pleasure. And people are stressed, and they seek pleasure in some unhealthy eating and drinking habits.
So when you look at the food industry nowadays, I'm not talking about the fast food primarily, but anything that will be alternative, like we're talking about organic food, we're talking about low glycemic index food, we're talking about a lot of that has to do with, like now with meat eaters, for example. I'm not sure if you're one, and I'm not trying to condemn anyone who is, but now they see that you could find alternatives to meat that are plant-based. Now, do you feel that this new wave of eating plant-based food, do you think this is going to be the new way to go? Or is it so full of chemicals to be able to kind of like taste like meat, but it is not meat? So all the transformation that they have to go through with the food that is not meat-based, do you think that can also do damage to the body?
I don't know honestly if it can do damage, but as we know, all our foods now, it's not like growing up in the 50s and 60s and 70s, and it's, comes right out of the ground, or nothing is enhanced chemically, and you don't have 32-pound turkeys and chickens, but I do think I don't see the plant-based um, food groups and restaurants and really going much more than to about the 5% of the people who really want to take care of their own health. I still think America in particular is pretty set in its ways, which is unhealthy.
Unhealthy, yes. So the first thing to do is basically getting rid of all the fast food restaurant. And then if they don't have a choice, but again, if you look at the irony behind it, doctor, where you see a bowl of salad that will cost someone $9, and then a burger, fries, a milkshake will cost them $3. So based on their finances, they will primarily go with the cheaper option, which can be the most destructive option for their health. So if they kind of like try to reduce the prices of the healthy food, will that change people's perspective?
Absolutely. And that's a great point. And when I have my patient, it's expensive to eat healthy.
Yes.
And it's more preparation, it's more cost. And if we could cut that cost, I know people would do it. But, if financially, as you said, you can feed a family of 5, for a third of the cost, by eating, the fast food and not, the organic, fruits and vegetables and greens and like the Mediterranean diet, which is, I believe, probably the most healthy diet we have.
Absolutely. Absolutely. So do you think this is a way for the pharmaceutical industry to be able to continue making money on us, which we are their client? Because longer they keep us sick, better it is for them. So why would they remove tools to keep us sick?
Well, that is the $1 million question.
Mm-hmm. Is there $1 million answer, doctor?
I do not have that, unfortunately.
Okay, well, at least we know where we stand.
Yes.
So where do you see the future in our society when it comes to people being sick, staying sick, depending too much on the doctors, and some of them are not really competent enough to be able to guide them in the right direction? What do you see, or how do you see people changing, and what will happen to our future or to the future of our kids?
Unfortunately, I'm very pessimistic. I have 3 boys of my own, and raised them and saw the differences in the adolescence of their generation versus our generation. For example, in my generation, it was safe. Here, people were outside. You didn't have travel, baseball, travel, soccer, travel, everything. And you played, and your parents basically, most of the times, dad's work, mom stayed home, and you were outside till it got dark. And I don't care if it's 10 degrees out or 90 degrees out. We had a hose out back. You could drink water when it's hot, get more scarves and mittens when it's cold. And we were generally, ate home cooked meals. And generally, from what I kind of still remember the few obese people in my class. And now watching my kids grow up and see the gross morbid obesity in elementary kids, junior high kids, senior kids, and I think it's due to the change of culture. I think we had one McDonald's here and a Burger Chef maybe at the time. And between the lack of activity, homebound doing video, convenience of fast food, dual working parents or single parents, I do believe this is only going to get worse.
So you can say with comfort that technology has basically destroyed us.
Oh yes, I think it's destroying our medical field, let alone the health of like every child that you can see. They're all married to their phone or their iPad and gaming and whatever, TikTok,
Yes.
where, they just don't. I mean, you can't go drive around the neighborhood or go to a park and see, boys playing basketball or, girls out and tennis or whatever, or just kids in the neighborhood playing kick the can or doing anything outside. I challenge people to see that. It's just not going to happen anymore.
Okay, so the only way to break the cycle, doctor, is if, let's say, you see parents that are overweight, those parents will definitely teach their kid to eat unhealthy. And those kids will continue on the same path as their parents, and they will eventually themselves become overweight, and the cycle continues. So, where beside education can we break that cycle and start raising a society that are healthier? Or this is we there's no way to look at it. There's no way to see anything positive from it.
No, and you're right. People will repeat the behavior that they saw. May it be good, may it be bad. And until I think the teachers, the school, as parents, we have to be more disciplined. People need more discipline. Everybody, and being a guy, if they gave me a timeout because I was bad, I'd be, I'd laugh that off. But I'm not going to say corporal punishment, but there was, some severe penalties in the past. And so until people want to really take care of their own health and know what the benefits are down the line and practice it themselves, you have to put everything into practice. You just can't think about it. You just have to do it. And when the parents or grandparents who are raising kids do it, the kids will see that. And, you just got to quit buying the cookies and the ding dongs and Twinkies and the pops that are loaded in every household.
So now I have seen a lot of schools, and that I was pretty shocked about that as well, Robert, is that now schools no longer accept sodas or Coke or Pepsi. Now they put Gatorade, they put healthy drinks, water for the students, etc. So do you think that if this trend continues, then eventually the cafeteria at school will start serving healthier options, and that may break that cycle?
Yes, I think that's where it has to start. And unfortunately, in our day, we got milk or you got nothing. So, but it's nice to hear that they are giving them healthier options. And if you're getting at least one meal a day, sometimes two for breakfast of healthy choices, they will carry that on, to dinner, and then when they graduate and either are in the workforce or go to college.
Beautiful. Now let's talk about your the book that you wrote, which kind of like enable people to, if let's say they feel certain symptoms, they could go to your book, they can actually read about it, get more informed, and not go on WebMD and say this is the end of their lives and okay, I'm going to jump off the Golden Gate Bridge or whatever
Right.
bridge you have in Ohio.
Yes.
And then it's kind of like start realizing, okay, you know what, if I have this may be because of that, and then I could call my doctor and figure out exactly what the best way to approach it. So how much of details is your book providing without making them see above and beyond what their diagnosis is? Because again, self-diagnosing a problem may not be the best solution either.
I really put a lot of effort into that. And what I wanted to do with each condition, chest pain, back pain, headaches, blood in the urine, just to name a few, I put in there what the red flags were. What are the words or symptoms that really catch my attention?
Okay.
Because and what really doesn't. And I think when they read the section, I'm very particular with what the symptoms are that are worrisome and what the symptoms are that aren't. And I really think they could avoid a lot of urgent care or emergency room visits with the way I detailed it. It's very simple. I put the terms that everyone could understand. And on top of that, if you do have a condition, I wrote like the medicines you should be on, what the most common side effects are, and what the standard of care or the algorithm you should be on for that particular condition.
Do you in that book, do you also put a section that says if you have that infection, then you should take this kind of medication? Or is it not, there's nothing that has to do with prescription of any meds, because then people will just start like wondering, okay, maybe I should just go and get it myself and that's it.
Yeah, the infection portion, I really stress no medication. My wife and kids are like, why are you a doctor? You won't prescribe, antibiotics. I'm like, well, really, when you look at all the data, 90 to 95% of our infections are viral. And that means antibiotics will not help, and the disease will run its course. And I'm talking mostly sinus infection, bronchitis, pneumonia, were the most common causes why people go to their doctor. And patients get very angry when they have 3 days of a cold, and I'm like, well, great, but you're not going to get anything, and call me back in a week if you're still having symptoms. And then they go to the urgent care and try to get an antibiotic, what they want anyways. So I do put in the most common medications. If you have a bacterial sinus, bronchitis, pneumonia, or kidney infection, urinary tract infection, I do give the recommended first, second, and third choices of the antibiotics they should be on.
Oh, okay. But because, if you have like blood infection or like cellulitis, that cannot cure on its own until you have a round of antibiotics to be able to take care of it. Because then the thing is, you have to really know what to look for, what to search. If let's say they're having like a certain infection, okay, that looks like the book that Robert Barkett wrote, so I should really pay attention to this. Or like you said, if you have a cough, let it run its course. It's going to go away on its own. The body immune system will be able to fight it.
And you made a good point with the cellulitis. That's obviously a different animal. And I do put that in my derm section or skin section and tell you, if the things we look for, is it a simple cellulitis and where it's probably strep we're treating, or is there a possibility and risk factors for that MRSA or the methicillin resistant staph infection where we would use a different antibiotic?
But then, again, because I love medicine, I love getting informed. Sometimes some infection like cellulitis or sepsis may have very close similarities. And then people will say, oh, no, this is not really that bad. But sepsis can be really dangerous and even life-threatening.
Oh, yes. Well, yeah, that's almost made when I see them in the office. Then if they're toxic, you're hoping, I'm hoping that people would read the book, but I'm still hoping that would not withhold coming to the doctor when they were feeling really sick and really when you're talking sepsis, they're looking toxic. They walk in, your patient, you walk in the room, you're like, oh my God,
Mm-hmm.
need to go to the emergency room, or
Oh, yes. And
hopefully we can treat you at home.
And I got like a few cellulitis infection, and that was scary when you see around the section of the infection where you see a red line going down your arm and starting to like getting closer to the heart. You say, oh, I better stop that,
And exactly.
This time around, it was scary. But now it seems like, oh, here we go for another one. And I know what antibiotics to take. It takes like 7 days and it's done. But yes, some people ignore those symptoms, doctor. And this is what we have to let listeners know. Don't ignore it. Don't say it's going to go on its own, because you don't know. You're not a doctor to know. Well, I'm not talking to you, but the listeners, that is, you're not a doctor to know if it should be seen by a doctor or that your body can fight it on its own. And a lot of people will let it go like that. They will let the body take care of it. And they realize that, oops, it made more damage than good.
Yes. And this is, like I said, a great medical reference guide for patients. And I think whatever condition, if they don't have that condition, their mom or dad or cousin or friend or coworker does have it. And it's a great checks and balances for patients for medical conditions. And, they can look through it. And, there's every doctor's not, there's young doctors, there's old doctors who haven't kept up with the current trends. And then there's younger doctors who are, definitely more robotic and using their computer and EMR and don't have the experience. And even myself, things do get missed. We're not perfect. Mm-hmm. And if you can go in and you have a certain condition, ask, hey, why don't I on this medication, or why haven't you run this test?
Yes.
That's a great thing. It's only going to benefit the patient. The patient has to look out for number one, and that's themselves.
Beautiful. Where can people find your book, doctor?
Well, Simple Medicine, no more Google searches, is on Amazon. It's on it's in Barnes and Noble. It's at my website called simplemedicinebook.com. It's also on, independent, bookstores like PAL and Indigo and BAM. And hopefully they can get it just about anywhere online.
Beautiful, beautiful. Well, doctor, that is all the time that we have for today's podcast. I really do appreciate you taking the time out of your very busy schedule to join us. And thank you again for participating and inspiring our many listeners with your incredible knowledge. Now, we hope that you've all enjoyed today's episode. And I'm also very excited about the many upcoming guests that we have scheduled for season 9 of the Happiness Journey podcast, filled with inspirational stories just like the one that you listened to today. Now, here are some concluding words of wisdom. If you can wake up every morning and love what you do by helping and inspiring others around you to guide them to be better than they were yesterday, then you know you're doing something right in business or in life. No matter what your purpose may be, always know that they were put into this earth to accomplish our mission. For many, they never get to really know or understand their life purpose. So they go on not really figuring out what they should do. They live life mindlessly without any direction. They may appear functional, but deep into their soul, they feel something is missing. Many will figure it out and change direction in their life to guide themselves in the right path, but not everyone is as fortunate. Question is, how do you figure out your life purpose? Well, for one, try to understand what happiness means to you. Learn to see how you can help others find their own purpose and take time to do some soul searching. It may be not obvious at first, but at the end, something will awaken from within and will help you fall into the path that you were destined to travel. This is not rocket science, ladies and gentlemen. It's just getting that feeling of happiness. My name is Dr. Dan Amzallag, and you may all keep pursuing your amazing journey in life.